Nervous system, identical. Therefore, if we were to place someone from the group on a dry fast on their 9th day, I'm uncertain we would observe that curve. Typically, the system ought to be quite exacerbated. It's normal during a dry fast. You feel tense. However, we could have some fun by performing frequency stimulations to restore frequencies of a healthy nervous system to see if it calms things down. These are things that have never been attempted. Yet it would be quite interesting to conduct. If there are those who are interested, it would be fascinating. It would be something genuinely natural, since we are merely transmitting a frequency from a healthy nervous system, so there's nothing to worry about. So we see at the stomach level and DNA a minor curve deviation, but it's not significant. We can evaluate the lung condition here, and there's a slight imbalance. I smoke. Yes. Do you smoke? Yes. Okay, we see she smokes. The curve deviation is evident. There are 2 squares, indicating an issue with the lung. She confirms she smokes. Here we are. We need to fix this as her lungs are a weak spot. Therefore, we will correct your lips and provide a treatment for them. Yes, indeed, that's excellent.
It's okay. Someone said you smoke a lot. Yes, thanks.
Yeah.
Someone mentioned you're smoking. Let me show you. What? They said that I smoke a lot.
No, you need to stop smoking. It's not good for you. So here it is. Now we can check if the bioresonance treatment we are doing has any effect. So we have cases where the organ is severely affected. For instance, a cancer patient with liver cancer. The liver stops functioning completely. We do this metatherapy and bioresonance treatment, and we see a response rate of 5 or 10%. Therefore, the bioresonance treatment we send is no longer working. We must, so we need to take another approach. This isn't effective anymore. The response rate for her lungs is 55%. The treatment will be very beneficial for you, as it has a success rate of 55%. In fact, we could even increase it to 3 times. We might not do it, but we could do it several times. Here, we see the heart state. So, we have a tiny issue here, but it still corresponds to 5-8 in the immune system. There is a connection. We can link the organs. Between the heart and here, we see the curve gap. 5-8 is at the immune level, showing a link to immunity. This is not surprising, since the intestine serves as the core of immunity. The immune response is primarily concentrated in the intestine, particularly in Peyer's patches. And so there may be a link between the intestine and the heart. Often people have heart diseases or cardiac issues. Well, it could also be infections that have penetrated. But there is frequently a connection to the digestive system. Liquid syndrome can cause more illnesses. Therefore, there you have it. Let's continue with our discussion. And I like it. So we could go see. Do you feel any pain? Maybe just a little in your lower back?
Yes, due to their surgery.
Ah, okay. So you see, it's interesting. He identified a small issue that I also see, specifically in the lower back. She says she had an operation on her lower back. This truly confirms it. We can find it later. An osteopath could have a better idea of its condition than I can. The lumbar region, the sacrum, the details, there you go. And now we can initiate some stimulation, since she knows she had surgery in her lower back. And there you go. So this goes back quite a while. We see that it's the red curve. It indicates the problem. It shows a deviation. We know there was an issue there. We apply a correction. We energetically adjust that area. But as I said, one session isn't always sufficient. A few sessions are needed. After that, it's the same. We could formulate a specific remedy for this. Remedies can be made for anything. Afterward, I do iridology first. It's a consultation. It takes an hour and a half to understand the individual in their entirety, physical but also emotional. Because emotions play an extremely important role in hepatology. When we fall ill, we lose our connection to ourselves. We lose our connection to our soul. We lose our inner self. Emotions and the mind have taken control. In emotional states, the uterine system falters, allowing pathologies to prevail. We must always intervene. The emotional side too, everything works in unison. We cannot only treat the physical. Dry fasting, of course, has an effect. It works on all levels. You will soon come out of your dry fast. You will feel this altered state of consciousness. We have the example of our friend Christian, who experienced great success last year. It greatly influences the mind. It will help clarify thoughts. Dry fasting is a comprehensive and holistic treatment. Yet we must also confront our past, our conditioning, and the burdens passed down from our parents and grandparents who shared all kinds of things with us. And essentially, we've been bombarded with stories about what we should do. We must escape from that. We must reconnect with our essence and articulate what we've expressed, affirm our identity, and vibrate with our true nature. And we must not seek to fit into what society wants from us. We must let go of all the judgments we hold about ourselves and those we place upon ourselves. We disregard others' opinions. We live our lives and do what we must. And there, we are on our life path, in our vibration. That's when things go smoothly. This is genuinely something significant. It's about saying what we need to say, doing what we need to do, and not worrying about others, their fears, or what they might say. Well, all of that is just talk. We must do what we need to do. And there is no one who should dictate what we must do in our lives. Only we know what we need to do. And that's how we move forward. In the journey of healing, it's by dropping our masks. Tomorrow, we will have an exercise to remove our masks. It's important, I forgot to say. It is essential to remove our protective layers. We need to find out who we truly are. Now let's go back to our bioresonance. We will analyze something here. Something that I particularly like to observe. The liver. Take a look. Liver, gallbladder. We saw the gallbladder. Usually we are dealing with something here. There are gallstones involved. You can see a significant difference.
No, I enjoy chocolate.
What does chocolate do? It blocks the liver and gallbladder, that's known. It's the extension.
What?
There it is. Would require remedies known as cholagogue choleretics. These are things that will activate bile synthesis. They are called cholagogue choleretic plants. We have plants like milk thistle and artichoke, etc., plus a bowl of water. We also have plants called ophocholoretics. These are plants that help regulate bile flow. For someone lacking a gallbladder, we will provide a plant known as fumeterre, a good plant that is also used for allergies. It's a good plant to regulate that. So we should give it treatments, but we will find a remedy. We check our database. Then we look at the plants.
It seems like a poem. It seems like a poem.
We examine the plants, and what do we observe? The celandine, which is an excellent liver remedy. Thus, we will add it to the print. Celandine is a great liver remedy. We record the remedy's production. We transmit the frequency. We can include as many as 7 remedies in a treatment vial.
It looks like a poem. It appears to be a poem.
We are making a remedy for
It
you.
appears to be a poem.
We are making a
Appears
remedy
to be
for
a
you.
poem.
Small waist. Here it is.
It seems that you just like...
Because horsetail is more renal than hepatic. That's why some therapists adhere closely to everything the device indicates. very poor. That's why you need to be a therapist, to understand and know the plants, to know a bit about what we do in therapeutic remedies, to provide the most suitable ones for the person. It's not the device that takes over. The device is a tool, and then it's the therapist who leads. The black radish is a major liver remedy. We'll give it too. You all know it. A treatment specifically designed for bile secretion. We will produce bile to help emulsify fats effectively. She eats too much chocolate, which harms the liver. The gallbladder is well understood. It's a tool that lets us quickly see the person's status and lifestyle. We can quickly grasp the situation and assess the condition of every system and organ accurately. We can examine food items to determine what works for her and what creates issues. We have various lists like vodka. Vodka is not beneficial.
Not alcohol.
Yes, she mentions she doesn't enjoy alcohol. There are various foods. We won't stay fixated on this list. However, it provides us with a few foods that are somewhat detrimental and should be avoided. Conversely, we have the beneficial foods, like dates. For instance, green tea is beneficial for your health, and so on and so forth. Kvass is a type of beverage. I'm not sure what they say about it. And then we have phytotherapy remedies. No, I mean lithotherapy. We can play around with zircon. We can look into what it relates to. I don't know lithotherapy by heart, but we can find help. We can look it up. Zircon would be a stone that is definitely worth using.
I don't like not...
We create this remedy. We place zircon into the remedy vial.
It seems like it could be a poem.
What's great is that we can follow a person. We see improvement session after session in the systems. That's what's interesting. We can really gauge the work we've done, if it had an effect or not.
that.
I go right now. We don't only focus on the gallbladder. We need to treat the liver beforehand. You need treatment for the upstream. You have to support your upstream. I will share some remedies with you.
It's
You need to assist your upstream in becoming better. If someone has liver cancer, liver disease, or hepatitis, they should receive bioresonance treatments. After that, there are herbal options and many therapies. However, dry fasting is truly a royal therapy for liver problems. We already have people who have treated hepatitis C. Someone who came to my Châtel retreat last year, a woman with hepatitis C. After retesting 2 or 3 months later, her hepatitis C was gone after just 9 days of dry fasting. A resident of Ticino, Switzerland. Dry fasting is potent. It is very effective for liver diseases. 62% response, great for treatment. You can see both images. Before and after metatherapy, the liver appears fully regenerated. We have restored its original frequency spectrum. Thus, we stimulated her liver to reach an ideal standard, a standard of health. Next, to advance the treatments. We don't have time for that here. However, I incorporate hypnosis with the individual to explore what we refer to as the triple treatment. She will visualize her organ and apply colors. I will take him into a little hypnosis. At the same time, I stimulate the metatherapy. This way we have a much more powerful and effective effect. So it takes a bit of time. There is a whole induction process. Additional work is required, but we can enhance the power of a treatment while blending hypnosis at the same time, which will have an effect on it. More on the organ. This has been demonstrated in China by hospitals. There were therapists who surrounded the area and medical imaging displayed in a surgery for ovarian cancer, and we observed therapists present who conveyed healing information, who had a clear intention. 4 people around a table with the sleeping patient. We saw the gallbladder regenerate. We observed quite spectacular improvement actions. So here we are in this idea of inducing the person. And the therapist can also induce a visualization of healing for the organ as well as bioresonance. So here we can do it twice. When the organ truly requires it, as it does now, we can perform stimulations. We can double the effect. So dry fasting is interesting. There is no limit. It's non-invasive. No interactions. And of course, the kidney is functioning well enough. I really enjoy watching this. It's elimination, the lymphatic system, like garbage collectors. So dry fasting at home is working great right now. There's a deep cleaning occurring. Thus you will effectively squeeze your, this is the best method to squeeze lymph, therefore dry fasting. So we can really assess the state of a lymphatic system. Thus we can provide it with some stimulation.
Alcohol is addictive. You don't like it, I don't eat.
That's a valid question. I'm not sure. We would need to see. Each person reacts differently. Some manage it very well. And then others, I have no idea. Each situation is personal. We should see. As I told you, those who want to come see me, even during dry fasting, we can do it. It doesn't bother me. There are no contradictions. Indeed, there are contradictions. Therefore, for a pregnant woman, heart pacemaker, we might avoid it. Otherwise, no contradictions exist. Here it is. An important image, that's also it. So, we see the venous system. We see that she needs it. She needs help with her venous system. You need it just for the vein. A bit of help is needed. So, what will we do? We will find our remedies. Come on, let's find her a dietary supplement. Come on, let's look for that. It could also be homeopathy, but we will look for a dietary supplement. What is it? Venetol. Also, I know this lab, I use it. Omega-3 aims at all blood thinners. Omega-3 is included. Venetol is a remedy. I have the details right here. It aids in the tonicity of the vessels, among other things. I provide this remedy, Venetol. He puts it in the bottle. I am preparing my remedy here that she can take home with her. Here it is. We are truly on the cutting edge of medicine that seeks the causes of imbalances. We are not focused on symptoms. Here it is. We are preparing our remedies. Following that, we will enhance this session with some lifestyle hygiene advice and small aids that are simple for the patient to implement and easy to adhere to. After that, I will meet with the individual again in 6 weeks' time. The entire diet must be taken into account. We need to pay attention. We will also perform treatment on the venous system, initiating an energy correction throughout it. also. So, I am a trainer in this technology myself. It's essential to understand that these devices come at a price ranging from 20 to 30,000 euros. It depends. There are several models. And it is specifically for therapists who want to add this to what they already do to better understand their patients. Naturopaths, doctors, many doctors use this globally. It is recognized all over. This is the original technology of bioresonance. Afterward, there are techniques from Germany, which are different systems. However, in my opinion, this is the most accurate device for diagnostics in the assessment of health. There is no better bioresonance device that I've seen, nor one better than this. In terms of precision, we can detect pathogens, bacteria, and viruses that no other device can identify. There you go. Here, for example, we discussed this issue of parasitism. We might want to examine it. Let's look in the intestine now. The intestines, and then Candida albicans will be found here. Here's the fungus, Candida albicans. I would prepare an antidote, but I won't, since it would counteract the remedy. We could make an antidote for Candida albicans here. Then, in addition, some plants and things like that to support a dietary aid. We're gently reaching the end. We see there's a small bacterium in there. It's not too serious, just a little pain in the elbow. Do you feel any pain in the... He mentions a bit, so it's not very significant, but there is a small pain, nothing serious, not much. So there's a bit of circulation, but it's not significant.
Because I've smoked too much.
Of course, because there's smoke, so it will disrupt circulation a bit. Overall, this analysis is rather good and insightful. Perfect, perfect, here you are. We observed system B, however, we will still verify it once more. We'll give it a slight push on the gallbladder. The thyroid, as we see a small curve deviation here. This is connected to the intestines. The cause is intestinal. Will help support the thyroid a bit. Done. So it takes approximately 1 hour for this analysis. You can visit me. We're here until 4 p.m. at your convenience. And then we also have here the arterial system. So we see that it goes somewhat together. Here we also have a curve discrepancy. We can also give a nudge on the arterial side at the same time. Here it is. Usually we see people who are seniors, especially after extensive stimulation. It can be tiring, it wears them out. People will rest and lie down. I have the Schumann plate in my practice as well. So people recharge on the plate and leave feeling good. It's important to know that standing on the Schumann plate gives a bit of energy. Thus, it enables you to recover some energy later on. This technique does tire you out a little after all. There it is. Just a bit. It varies from person to person. It's about vitality, really. And then therefore, we ultimately conclude with the overall position of the entire body. At this point, we re-establish a balance among all the systems. So we are focusing on a global energy harmonization. and often reactions can occur. I don't know if you have what are termed elimination or healing crises. This may cause symptoms and increased pain. That's a good sign. It means your vital force is working on regeneration and elimination. Someone who has no symptoms, absolutely nothing. I wouldn't call it suspicious, but it might seem strange. If symptoms arise, it means the vital force is starting to establish itself and do its job. To eliminate an issue based on priority. I don't know if you prioritize your work. And this technique actually helps to create additional harmony. To create a balance in homeostasis, in regulation. Overall body structure. This is where its significance in balancing the energy system comes into play. Any questions? Anyone have a question? Are you okay? No specific questions? So feel free to come. So come as you wish. Take advantage of this. Thank you very much. Very good. Thank you. You will be leaving now. The patient of yours always goes home with, just take 2 or 3 drops 2 times daily.
2 times a day,
2 times
morning
a day.
and evening.
You can take it with meals. It doesn't matter. 2 or 3
times.
drops 2 times daily.
Okay.
Whenever you want.
You think one voice is better for translating, right?
Here you are.
Thank you.
Thank you to you. Thanks. Thank you.